now a question of making it as low as possible rather than totally eliminating. Now they're working towards that, and I think it's good to see that there's continuous science and studies for that, and that's one of the reasons why I went ahead and became accredited with them. So here's what we do. Post consultation with Janet Tanner, we get into making sure that our patients are aware of all of the advantages and disadvantages of what we're doing. So we go through a written informed consent process. And of course we want to make sure that our environment is protected as well. So in the province of Ontario, every dental practice is required by law to have a mercury amalgam separator. Does it do a good job? Yes, 99.9% of mercury is removed before it enters into the municipal water supply. So it still means it's 0.1% that's getting out there. So it's not perfect, but it's most certainly a step in the right direction. One of the other things that we employ, because of the guidelines from IAOT, is an ozonator. In this practice, what we do is we turn the ozonator on, and it helps to kind of ozonize the air and clean it up for us. And one of the key features of this practice, and any practice that wants to get into safe mercury removal, is some form of a vacuum that is able to draw any of that vapor that's coming off a tooth removal, and then put it through a filter medium, like activated charcoal, so that it absorbs that mercury. Or in this case, what we've done is we've designed a mercury removal vacuum system that pushes that out of the room, out of the office, and in fact, out of the building itself. Okay, so we're trying to be as safe as possible, right? And make it as easy as possible to use. Okay, the other factor, of course, in all of this is providing clean air supply. Again, it's a matter of not wanting to breathe any of this stuff in. So we provided our patients with a nasal cannula. The most recent guidelines are now asking that we provide a nasal hood for our patients. The ones that are similar to laughing gas masks that cover the entire nose. The thinking is that we don't want the patient to breathe any of this stuff in. So clearly, if you had a nasal hood, that's a significant barrier compared to a nasal cannula, which is two little tubes that stick up the nose. We drape our patients, cover them over in the least with some form of bib, but ideally, of course, some form of a barrier that covers the entire body. We employ evacuation techniques. So there's a saliva ejector that goes behind a dental dam. The kind of dental dam makes a difference. They found with their research was mercury goes right through latex. So it's almost as if there was no barrier there. So if you have a dentist that's doing mercury removal, you want to make sure that you don't use a latex dental dam. Probably don't want to have any latex in your office anyway, because it's such an allergen, it seems these days. And of course, finally, we employ something called a cleanup tip. And what it is, it's a device that, very quickly on that. Those are dental mercury canister masks, of course, and what it does is it helps us not breathe any of this stuff in. The interesting thing is that I'm sure you've heard that Switzerland was one of the first countries that outlawed the use of mercury in the dental office. And for the longest time, it wasn't because of a movement by organizations like the IAOT to prevent the use of mercury. Their approach was actually the environmental impact of mercury. So because of dental office effluent containing mercury into the environment, the Swiss said, we don't want that. It's not even safe for our environment. We're going to ban it from our country altogether. It was an interesting approach. And of course, biological support. There are certain adjuncts that we can use that will help clear up a lot of the mercury that is breathed in at the time of the appointment. One of the things that we use is a product that helps to, I don't want to say chelate, but it helps to bind some of the materials that do enter inadvertently into the intestinal tract. And there's the cleanup tip, a little square that sits nicely around the tooth, and then it extracts and evacuates away as much of that dust as possible. Okay, now After we're done, there are several things that can happen. First of all, it may be that you don't notice any health change, and I find that that's perhaps the most common response to our patients that do have safe mercury removal done for them. I think part of it is we haven't really been tracking what their symptomology was like before and or after, so they kind of go through the whole process and don't notice anything different. There is another instance of a worsening of symptoms, and I can tell you that it's not necessarily just because of poor removal protocols. I just had another patient I had one patient the other day who came in after even the use of safe mercury removal protocols, and she was noticing symptomologies consistent with mercury exposure. The truth of the matter is that she probably already had a fairly high level of toxins in her body, and sometimes just a little bit more of mercury just pushes you over the edge. And so we always have to warn our patients before they get into any sort of mercury removal, even if it's safe mercury removal. We don't know what their toxic loads are like, so we have to tell them you have to be prepared for one of these potential outcomes. Okay? Sometimes it's better health, and we hope that that's oftentimes the case, and we do see that happen as well. We have patients that come in and they tell me that their lives have totally changed, and it's very, very rewarding. It's very validating to hear that when we see patients that come in and report that to us. Oftentimes that's very rare, because one of the truths of mercury is that it's cumulative, meaning that it doesn't just stay in the fillings. So by nature, it actually gets out of the fillings into the body. So more often than not, any improvement that you notice is from the abatement of any electrical interferences from different metals in your mouth. More often than not, they'll notice a more gradual improvement over time as the mercury is gradually removed from their body. So this is where a course of nutritional support can play a huge role in getting that final better symptoms after mercury detoxification. Some of the guidelines that we want to ensure that all of our crew tell our patients is we want to ensure that they get balanced, scientific, supportable information, of course. Do keep accurate records of all of the things that we do, in fact, and make sure that we follow protocols. And here's the interesting thing. In the province of Ontario, dentists cannot diagnose mercury toxicity. That is outside of our scope of practice, so only a medical doctor or perhaps a naturopathic physician can actually do that. So more often than not, if we do notice any of our patients that do exhibit some of the symptomologies, your dentist or whomever you're seeing should be referring you to a medical doctor or a naturopathic doctor. Okay. So we should never ever diagnose that as a dental healthcare practitioner. Okay. Now, mercury testing, this gets into some pretty heavy stuff. Yes?
Sorry, as a dental professional, are you allowed to suggest that could be the case and to refer them to their MD for confirmation?
Absolutely.
Yeah.
I think what our patients, when patients come to us, one of the things that they're relying on a dental professional for is to help them kind of work through what is accurate information and what is inaccurate information. And they're trying to kind of wrap their minds around, what they're feeling, and sometimes you see some of those symptomologies there. And as I mentioned to you, one of the things that the people around you will tell you is that you're just getting old. You're forgetting stuff, but it's just a natural part of the aging process. So there's a tendency to dismiss some of these symptoms as just that's the way things are. But you have to ask the question: what if it's not, right? And oftentimes it's a matter of asking the appropriate questions for that particular patient, assessing their age. Are some of these symptomologies consistent with their age? Is Alzheimer-like symptoms, is that an acceptable part of the landscape of growing older? I want to say it's not, because I'd like to think that as I grow older, I'd like for my mind to be as sharp as it is now, all the way to when I'm, say, 90, right? So, you know, I think we owe it to our patients to become educated on this and then refer them to the appropriate medical doctors or naturopathic doctors. When I went to see my medical doctor, one of the things that I asked for him to do is to run a blood test. And one of the things that he did was, and actually in the province of Ontario, a blood test for mercury is actually covered. So the next time that you're in for your yearly physical and you were getting any blood tests done, and if you're in the dental healthcare field, you know, make it a point to ask your family physician, you know, do a blood test for me. Yes?
I just want to ask, such symptoms might be common in many diseases, as you just mentioned, especially age-related.
Mm-hmm.
So with doing such blood tests, and if it shows that mercury is high, would it just confirm that the cause is mercury?
It does not. It does
So
not.
how can we just confirm?
It's interesting. That's where you have to get into a conversation with a medical doctor or a naturopathic doctor. I would suggest you to see a naturopathic doctor, not because that medical doctors are averse to rendering a diagnosis for mercury toxicity, but I find that naturopathic doctors tend to have a little bit more of the sensitivity to that subject matter. So, did I answer that question?
Yeah.
Yeah. I think what happens too is if you're getting blood tests done for mercury, one of the things to realize is that mercury levels in blood tends to be very fleeting, meaning that you know, in our case as a dentist, when I'm going to remove mercury amalgams from my patient, we get a shot of mercury and that goes into our bloodstream. And if you took a blood test reading at that point, you'd see a fairly high dose of it, but it kind of dissipates over time. The reason for that is because all of that mercury is actually absorbed into tissue. And then of course, as the blood levels reduce, usually there's a half-life of like 24 hours or so. So as that level of mercury goes down in your bloodstream, the mercury that has been absorbed into your tissue now re-enters the bloodstream again, so it maintains that mercury level at a certain baseline. I had myself tested, and one of the things was I noticed that it had increased over time, and I bugged my family doctor to the point where he said, you know what, if you ask for me to do another mercury test, I don't want you as a patient anymore. I'm like, wow, great. You know, I don't want to burn any bridges with my family doctor, so I didn't push the issue. But the truth of the matter is, I think he's starting to come around. And the last time I saw him, I had my blood test done, an acceptable level is somewhere in the 9 range, and I was like a 7. So I was pretty high up there. He said, you know, don't worry, you're still normal. You don't have to stop working. That was, talk about bedside manner, man. I know him for such a long time, so I knew his brand of humor. The fact of the matter is that, you know, blood tests are one thing. It'll give you a general idea in terms of what your mercury exposure is like, but you really need to get into more specific tests to determine what your true levels of mercury are in your tissue. So the two that are out there tend to be the DMSA challenge, and then there's another test by a company in the States called the mercury tri-test. And when we get into that mercury tri-test, I had that done on myself as well. I can't remember my results. I'm sure it was way up there, but essentially they take right in the 90s. I shared my results with you, didn't I?
Yeah.
So I was very, very high up there compared to the population as a whole. So that's worrisome when you see that as an individual. I mean, not even as a dentist, but you know, you start to worry. In simple terms, if you ever have the mercury test done, what they do is to take a hair sample, urine sample is done, spot test in the morning, and of course there's a phlebotomy done as well. They take some blood. Not a lot of doctors out there that do this, so what we've been trying to do is locate doctors within Barrie, within your community that are able to do that. The key to this test, of course, is that the samples need to be fairly fresh, particularly the blood sample, because it needs to be shipped over to the States. Okay, recommendations. As I mentioned, as dental healthcare practitioners, your dentist shouldn't be diagnosing mercury poisoning. Again, that's outside of the scope of practice for dentists. It is, however, more the realm of your medical doctor and your naturopathic healthcare practitioner. there's a lot of controversy over the use of chelation medications and intravenous chelation. Huge controversy over it. One of the one of the naturopathic doctors that I've spoken to recently, in fact, highly is against IV chelation. And his reasoning is that if you're going to do any chelation, what it does is it pulls all of these toxins out of your tissues and into your bloodstream, and it just redistributes it over your body. Now that's a bit of a problem because, again, the tendency for this stuff is to go into key tissues, brain, kidney, and liver. And the last thing I want is for this stuff to head upstairs. So what his approach is more of a oral chelator. For better or for worse, it really depends on your philosophical belief and the research that you do. But by all means, chat with your naturopathic healthcare practitioner to get more information on that. We can never promise our patients systemic health improvements because, as you can see earlier on, there's really no predictable way to determine what kind of outcome our patients will experience. There are certainly tests to do to determine what your levels of mercury are. But again, the confounding factor here is that everyone's ability to detoxify their body is extremely different, depends on your genotype and your environmental exposure to other toxins as well. So one of the things, for example, is if you start mixing in other heavy metals like lead in addition to mercury, that's a deadly combination because it then magnifies the effect of both of those toxic elements in your body. Okay. Informed consent is extremely important. We try and stay away from this kind of fringe science approaches, so the amalgameters, applied kinesiology, the muscle testing stuff. Part of it is because it's really variable from practitioner to practitioner. It's not to say that it doesn't work, it's just that it works very well in some doctors' hands, it may not work in others. So there's no consistency to it, and that's one of the reasons why organizations like the IAOMT that's based on science tends to shy away from techniques that aren't necessarily reproducible in different doctors or healthcare practitioners' hands. Okay. Now, if you'd like a copy of that presentation, send me an email. I'll fire it off to you. If you have any questions, I'd be more than happy to answer them for you. Otherwise, let's head with the right.
Is it, what's the difference in terms of toxicity of removing, say, the complete tooth rather than removing the filling from a tooth?
It's a good question. I guess it really depends on the amount of mercury there is on the tooth itself. So what oftentimes happens is if it's a relatively small volume of mercury, then I would strongly suggest don't remove the entire tooth. You know, in the same way that you wouldn't chop off a leg because you have a broken toe. What I would suggest is isolate that offending filling as much as possible using those protocols, and then as much as you can safely remove that small filling. For a larger restoration, so long as that pulp chamber and nerve is intact, you're still well off to remove the mercury filling and try and restore the tooth using CAD/CAM technology and ceramics. Larger restorations will benefit from the use of materials that can really hold up the chewing forces. So you want to stay away from the plastic fillings out there. I would say in a case where there's clearly a lot of destruction of the natural tooth itself, and the tooth is to the point where you need a root canal, and even at that point it's questionable, then you may want to consider extracting the tooth instead rather than fighting an uphill battle.
Thank you.
Good question.
I just want to ask you, you've mentioned that we can make blood test or a urine test to measure the amount of mercury. So if a urine test is a possibility, wouldn't that mean the body would eliminate mercury?
Yes, absolutely. One of the things that's done in a urine test, the DMSA challenge, for example, what's involved in that particular test is you take DMSA and you actually have to monitor your urinary levels over a 24-hour period. So oftentimes the participants carry around a collecting bucket with them. A little inconvenient as tests, but it does work. One of the dangers of it, of course, is that because it's extracting mercury mercury out of your tissue, it does create a bit of a bump in your experience of mercury levels in your bloodstream as well. So there's a certain risk in doing a test like this. The typical excretion pathways for mercury tends to be through the feces, through the gut, and through the kidneys as well. So your body does excrete it. You saw earlier on the half-life of mercury within the bloodstream is about 3 days. However, what we're all worried about is the stuff that gets drawn into your tissue and then stays in there. Right, it stays in your tissue. So that's the stuff that is extremely difficult to eliminate. What I'm most concerned about is, as a healthcare practitioner, right, when we go to cut a mercury filling, one of the things that happens is it blows all of this stuff into the air, and it's the mercury vapor that is essentially an atom in a state where it's uncharged. Being uncharged, what happens is it crosses the blood-brain barrier very, very easily. Once it crosses that blood-brain barrier, it picks up a charge and then becomes a divalent atom. It then sticks to, I believe it methylizes, I guess. One way or another, it reacts to the point where it cannot go out of it can't go past the blood-brain barrier again. And because of that, it tends to accumulate in the brain very, very, very quickly. So, you know, in a case like this, when the source of that mercury is coming from fillings rather than diet, you'll see you should see a higher concentration of mercury in brain tissue. But that's more difficult to excrete. So if you kind of put two and two together, you know, if the majority of mercury exposure from what the World Health Organization study was saying is coming from mercury fillings, then really the danger from this is the stuff that's coming off the fillings themselves, volatilizing and then entering into brain tissue. That's perhaps what I'm most worried about.
So, in respect to my position, one of the chelation, a natural chelation, is
Yes.
with cilantro oil and chlorella. Is this something that I should not be suggesting to our patients based on what you've been taught with the IOMT?
I think there's a strong movement to recommend that. So by all means, we should include that in our diets. I'd like to see more research in terms of how effective dietary adjuncts are, like chlorella and cilantro.
There's a great protocol, it's a Kleinhardt protocol. That's something that I can provide for you if you wanted to look at it.
Absolutely.
But if it was followed strictly, it is a natural process. It's not like an IV sedation.
It's not intravenous,
chelation, yes,
Exactly.
that you would get with your naturopathic doctor, or supplementation through them, but it is very natural.
Yeah, I would highly recommend it for our patients. I mean, it's an option.
Mm-hmm.
You know, I don't want to say alternative because you don't have to choose one over the other. And oftentimes, if you can combine a lot of these complementary steps, in my mind, all the better, right? I mean, the truth of the matter is that I'm willing to try anything to ensure that my body's able to eliminate as much of this toxins as possible.
There's also a homeopathic remedy that is basically mercury just diluted, because that is what homeopathic medicine is.
Mm-hmm.
So that's also another option for patients as well.
Yeah.
That does not, it's not seen as like more of a medical procedure, it's more of a natural procedure, so
Okay.
we could also offer them options.
Yeah, it's interesting because you talk about the use of mercury to treat mercury.
Yes, which is like cures like.
Like
which
cures
is-
like. I don't have enough experience in that to render any form of recommendation for it. What I know has happened in the past is mercury was actually used as a disinfectant. Mercurochrome was the product. I'm not sure if any of us still remember that or not. If you look into an old medicine cabinet, you might still find mercurochrome used, and it was used in the same way that iodine was used to kind of dress a wound and clean it off. Of course, it fell out of favor. I think the only other place that it still, I want to say still, or was used, it was in veterinary medicine in horses. And I'm not sure if that's still the case anymore. You know, I would imagine it's not safe for horses. But yeah, in many ways, you know, it used to be used as a disinfectant, to the point where, I recall reading this somewhere, I think it was Diagnosis Mercury, and it was written by a doctor on the West Coast, and she related a story where a mercury product was used in the actual wall of the medical treatment operatory, with the belief that it would help to act the same way that microban would work. You know, it helps to kind of kill away any bacteria that would accumulate on the surfaces. I think it's still in use. I suspect it was too dangerous to simply remove the stuff, so they just simply painted over it instead. There's an interesting political aspect to all of this. There was back in the days of Desert Storm. One of the things that was being done was grain products were being shipped to the Middle East, and in order to preserve the grain, they were treated with a mercury product to prevent mold growth. The problem was that when you ship this grain to an environment that is war-torn and the people are starving, they aren't necessarily going to take that grain and grow it. They're going to actually kind of grind it up and consume it. And the unfortunate fact of the matter was the unfortunate outcome of all of that was that rather than the Middle Eastern population taking that grain and growing it and creating their own crop, was they ground it up, they consumed it, and there was a huge incidence of mercury poisoning coming out of the Middle East, which is where some of these products for mercury chelation came out of. A bit of a history to all of that. It's a way more detail that I can get into. But if you want, I'll send you the link for that. There's a great book on it that details the whole history of some of the worldwide incidences of mercury, not just in the Middle East, in Japan as well. Very, very cool stuff. Thank you so much, ladies and gentlemen, for being part of this experience tonight. Thank you for your time.
Thank you.
Try the vino, get into the cheese, enjoy yourselves. Thank you so much for coming in tonight.
Okay, you insist.